Breaking. VA proposes banning most abortions. Impact on veterans' reproductive rights. Imagine being denied life-saving medical care because of politics instead of patient need. That's exactly what's happening for thousands, particularly women veterans, who've risked everything for our country. The U.S. Department of Veterans Affairs, VA, has quietly moved to ban abortions at all its facilities, calling the recent expansion of services legally blurry and unnecessary. This new interim rule reversal sends shockwaves, forcing patients to seek outside care, even in states where restrictions make it nearly impossible. But here's the crux. The VA frames this as a return to medical basics, while critics call it a dangerous erosion of healthcare access for those who need it most. In 2022, the Supreme Court overturned Roe v. Wade, leaving access uneven across states. The VA had stepped in to provide abortions, even in restricted states, as a critical health measure. Now, citing legal concerns and what it claims is low demand, the VA is revoking that humanitarian lifeline. Its rationale? The original policy was a political overstep, rather than a response to real needs. Internal VA data reveals an average of 100 veterans and 40 CHAMPVA beneficiaries, family members in partner programs, annually use these services. But opponents counter. Nearly 500,000 women veterans of childbearing age rely on the VA, with more than half residing in states that now severely limit access. The VA insists exemptions remain for emergencies like ectopic pregnancies or miscarriages. Yet advocates like Nancy Northup, Center for Reproductive Rights, argue this reversal strips freedoms from veterans after they've already sacrificed for the nation. Dr. Skye Perryman, Democracy Forward, adds it's a slap in the face to bodily autonomy. Meanwhile, Republican lawmakers applaud the shift, claiming taxpayer funds shouldn't finance abortions. And a public comment period runs through September 5, inviting input before finalizing the rule. The stakes are high. Senator Patty Murray, D. Washington, warns this shows callous disregard for veterans' health, while House GOP leaders argue preserving sanctity of life aligns with core values. Here's the paradox. The VA claims low usage justifies the ban, yet its own numbers show a targeted need that's far from insignificant, especially when 500,000 women in restricted states depend on VA care. Where do you stand? Should medical decisions follow legal maps or patient needs? Should veterans' access depend on state lines or their sacrifices? These are questions the VA's policy now forces the nation to confront. Whether you agree or disagree, one truth remains. This isn't just about politics. It's about lives on the line.